Yes.
So all the S13s you have tendered there for elders, what do they total to? How much of the 172 million was received by elders?
Of elders, the total elders received is 15,300,000.
Where is that in your records?
In the summary.
Where is the summary?
They did not request yet, Chair.
You knew you were coming here to provide evidence that 172 million worth of pharmaceuticals was distributed to facilities properly. That's the issue. We are not coming to question whether the procurement from KEMSA was proper. That's not the issue. And I mean, if you are to focus on that, would be pedantic. Our concern is that the 172 million was received in public hospitals and was not diverted to private hospitals. That's what we are trying to establish. And I think the governor must have understood that well, because in his written response, he has said that there are records that provide evidence of receipt, custody, distribution, and issuance of medical supplies to the intended facilities. So, just speaking elders, you are saying that in total it was 15 million,
yes.
And we are asking where is that evidence in the file?
Chair, I was relying with the audit query, which lump sum put 172 million. Then in that 172 million, we had two vouchers, which is in inspection, which one is 89 and the other one is 85. So I was trying to support in line with the query.
We don't have a big problem with the distribution and the arrangement with KEMSA.
Yes.
Our problem is, did the facilities receive the pharmaceuticals? And the pharmaceuticals they received, do they tie to the 172 million that came from KEMSA? It's as simple as that.
Yes.
So give us that evidence, give us that assurance, and we can move on.
Chair, the evidence is in front of you. We have the ledgers, we have the S13, we have the appointment letter for the inspection, we have the requisition, and the inspection certificate signed by the appointed committee members.
Auditor General, because I said when we started that we are not doing the audit today.
Yes.
The audit ended when the OAG brought the report on 31st of December. Can you give us an assurance that the 167 facilities in Wajir received medication pharmaceuticals, and the pharmaceuticals they received, the total ties to the 172 that came from KEMSA? Are you able to give that assurance, or do we ask the county to provide that information?
Chair, as the auditors, we can only give what is called reasonable assurance, but not absolute assurance. So maybe I'll pass the ball to the governor. Thank you, Chair.
Governor?
And Chair, I've explained the process of consolidating requisitioning. And once the requisitions are consolidated, an LSO is given for what is required of KEMSA in totality, but with a breakdown of how much will go directly to every facility. So the packaging takes that into account. And that's why it's a last mile delivery. Once that reaches there, the KEMSA person also, because has to demand for payment, has to ensure that the facility in charge signs a delivery note. It is not expected, it's not rationally expected, and I must say this, that the bin cards or the store ledgers for every facility, because these are not things you carry away, they are per product and they are kept at the facility, will be kept at the headquarters. They are at the facility. So it's up to the auditor to say, I need proof of this delivery for this product for this facility. Then we provide the delivery note from the facility so requested, because you're talking about 167 facilities that have received products directly. And if they want to know at what stage of consumption there is, then we give copies of the bin cards. So when we saw that comment, what my people did is now they asked the store people, the facility in charges in every facility, to send the bin cards of every single facility. So I think unless the auditor says I need this particular thing in this particular form, this is our response. I don't know how else to explain.
It is not what the auditor wants, it is what the Senate wants. What the Senate requires is clear evidence that 172 million worth of pharmaceuticals and non-pharmaceuticals that were procured from KEMSA reached the intended facilities. That's all. That's our concern. Sitting here, we have seen cases where in a very foolproof exercise, counties procure, counties get medication, but that medication goes to private hospitals. That is the suspicion that we must allay. And so what you must do, as your officer says, that there is no summation of deliveries to the respective facilities, you must provide a summation that accounts for that 172 that will then be supported by the ledgers and the S13s that have been attached here. Sitting as a Senate, that's the most we can do. We cannot go through every single S13 or every single ledger. So provide a summation of the deliveries out of the 172, the facilities that were taken to, and how much each facility received. And then we'll ask the Auditor General to just run a test to confirm, and we can close this matter. Governor, I hope that is clear. It would be
Yes, Chair. Yeah. I think what I'll ask the people to do, because delivery notes was not one of the things that was asked for by the auditor, why not just get every single signed off delivery note that added up to those two LSOs and provide it to the auditors?
Yeah, provide to the Senate through the auditor. Please, remember it is the Senate asking, it is not the
obliged.
So I think that should be a very straightforward exercise where you have a schedule, if it's 167 facilities or 50 facilities, indicating the quantities and amounts received, and then they can be supported by the ledgers and the S13s. Is that clear? And that's doable. Auditor General?
That's okay, Chairman. We'll comply with the directive. Thank you.
Let me ask Senator Cherargei to go on record.
Cherargei Kiprotich is my name, Senator of the Republic of Kenya, representing the great people of Nandi. And Chair, my apologies, I was in parliamentary board meeting. Mine is just, we have waited for this meeting for very long. Having the governor refused to appear on several occasions. Mine is, Governor, you are contradicting yourself. If you read your own response, page number 3, steps taken. I thought these are already steps that you have taken. Because you have said the management has directed relevant department to strengthen issue of record keeping, document inventory, management controls. So I thought the one you are saying has already been done. So which is the position? Are you running away from your written submissions that you are going to undertake in future, or it has been done? That is page number 3 of your management responses, where you have put there, then the management and stores officers, because I'm seeing the chair you are directing that the Wajir take. I thought they have already taken because it is written steps taken. So I thought they have already done. They are giving feedback on the matter.
Okay, I think you gave you an opportunity to go on record, but you could benefit also from some of the conversations you have had prior to your arrival. I think we have gone through all those issues of documentation, the gaps, the complexities, but what we are concerned about now is accounting for 172 million and making sure that that 172 million went to public hospitals rather than private hospitals, or it was actual delivery rather than phantom deliveries. So I think let's leave it at that, Honorable Senator. When we are reviewing the responses, we'll also be able to consider whether the steps taken will close the gaps in future. Senator Melegu?
Chair, I wanted to ask whether the county government included all the S13 forms for every facility, because when I sample Aldas Sub-County Hospital, there are about 4 S13 forms, and when we do the total of the amount of medicine they received, it's actually less than 1 million shillings. So I don't know if this is a sample of S13 for Aldas Sub-County, or it is all S13 forms. for Elders Sub-County Hospital.
Does Annex 1 have everything, or it's a sample?
It's a sample.
Governor?
Simple. Chair, taking the questions one by one.
I think respond to Senator Legos. I've addressed the introductory remarks by Senator Kajwang, so don't go there. The question is just direct. Is Annex 1 a sample, or it's the entire universe?
It's a sample.
Okay, so let's go by Pareto's principle, where they say 20% of facilities generally contribute to 80% of the problems. So in that submission that we have already agreed will have to be done,